Good afternoon. My name is Bob Troester. I'm the acting United States Attorney for the Western District of Oklahoma. Earlier today in Washington, D.C., Attorney General Jeff Sessions and other leaders of federal agencies announced the largest ever healthcare fraud enforcement action, involving 601 charged defendants across 58 judicial districts. They included doctors, nurses, and other licensed medical professionals. It was for their alleged participation in healthcare fraud schemes involving more than $2 billion in billings. Of those charged, 162 defendants, including doctors, were charged for their role in prescribing and distributing opioids and dangerous narcotics. We are facing one of the deadliest drug epidemics our nation has seen. The misuse of and addiction to opioids, including prescription pain relievers and synthetic opioids like fentanyl, is a serious national crisis that affects public health as well as social and economic welfare. A few statistics from the Centers for Disease Control and the National Institute of Health bear this problem out. The United States comprises only 4.6% of the world's total population, yet consumes 85% of all oxycodone and 99% of all hydrocodone in the world. About 80% of those who use heroin have first misused prescription opioids. This misuse is often deadly. Opioid overdose deaths have increased by more than 5 times from 1999 to 2016. And every day, 115 people die overdosing on opioids in the United States. That is one person every 13 minutes in the United States. Regrettably, this epidemic has hit Oklahoma as well. And we are here today to report on what we are doing to combat this crisis. We're going to share some Oklahoma statistics in a minute. John Scully from the Oklahoma Bureau of Narcotics will share some of those with you. But before we move to that, I want to say this is clear to our team. We cannot go about fighting this opioid crisis with a business-as-usual approach. That is why, together with my law enforcement colleagues that are here today and some that couldn't be here today, we are announcing the Western Oklahoma Opioid Enforcement Team, which actually started meeting just a couple months ago. In this team, we are bringing together state and federal investigators, each bringing very unique expertise and resources. And you're going to hear from some of those agencies in a minute. We have also joined forces as state and federal prosecutors with both criminal and civil goals in mind, with the State Attorney General's Office and the District Attorney's Office here in Oklahoma County, with David Prater, he could not be here today, and also the District Attorney for Greg Mashburn for Cleveland, Garfield, and McLean counties, again, who could not be here today but are members of our team. In my office, I have very committed team members that are also working on this opioid crisis, including Executive Assistant U.S. Attorney Scott Williams and Assistant U.S. Attorneys Amanda Johnson, Amanda Green, Jackie Hutzel, and Scott Mall. In addition, our office has also received a newly allocated civil prosecutor position to further strengthen our focus on the opioid crisis. Our team has also had the benefit of national resources through the participation of the Consumer Protection Branch of the Civil Division in the Department of Justice. Our goal is clear: combine the expertise and the resources of both state and federal investigators and prosecutors working together, collaborating to pursue a multidisciplinary approach which will use every available criminal, civil, and administrative tool in our arsenal, where appropriate, to target, prosecute, and stop those responsible for the illegal distribution of these addictive and potentially deadly drugs. Whether those individuals responsible are street dealers, organizations, or medical professionals. We know that most medical professionals understand the problem. Most recognize the dangers of these drugs and exercise sound professional judgment in prescribing only those drugs in the usual course of medical practice that are medically necessary for a specific patient, to treat a specific legitimate need, and prescribe for a limited specific time period. However, as in all professions, there are some in the medical community who are more concerned with profits than their professional responsibility or their patients' welfare. We will not give special treatment to someone simply because they wear a lab coat or have a prescription pad. We will use drug trafficking statutes when the facts and circumstances call for it. We will use healthcare fraud statutes where appropriate, because the opioid epidemic is compounded when taxpayers are forced to pick up the tab through Medicare, Medicaid, TRICARE, and a host of other state and federally funded programs. Taxpayers work hard every day to fund these critical healthcare programs for our fellow Americans. But there are some who have chosen to violate their oaths and exploit this generosity to line their pockets. As stated earlier, 1 death every 13 minutes in the United States. We must stop the deaths and loss of our loved ones. The members of this Western Oklahoma Opioid Enforcement Team are resolute in our commitment to work together to reduce overdose deaths, addiction, and the illegal diversion of prescription opioids. With that, I will now turn it over to John Scully, the Director of the Oklahoma Bureau of Narcotics and Dangerous Drugs. John?
Thank you, Mr. Troester. Good afternoon, everyone. At OBN, I would like to say that our footprint around the state is our headquarters is located in Oklahoma City. We have 5 district offices around the state, and we have 15 regional offices around the state. We're proud to partner with all of our law enforcement partners behind us, as well as health workers, to try to combat this opioid addiction issue that we face in Oklahoma. We're no different than the rest of the country. That's evidenced by the next slide. If you'll look at the overdoses, these are overdose deaths that we've had in Oklahoma. These are numbers, statistics that we get from the medical examiner's office. If you look starting with 2003, the number was 467. Now look at 2016, the next to the last column, we have 899 documented overdose deaths. In 2017, that number's come down a little bit, so we're encouraged by that. However, we know that as toxicology reports are completed, we may have a few more numbers that would come in. If you look at the next slide, of the overdose deaths that are confirmed in Oklahoma, 379 of those in 2017 were from opioids. If you look at the next slide, now this is a comparison of opioid overdose deaths in Oklahoma starting with 2013. The numbers fluctuate a little bit up and down each year, but in 2017 that numbers came down to 379. We all want to get excited about that, and we all think that that's great news that the numbers are coming down. Obviously, that's 379 too many people. However, our next concern that we have to watch for is the heroin epidemic. As we do such good work with all of our partners back here to reduce the diversion of opioid pain pills, we have to monitor what happens with our heroin overdose deaths next. And if you look at that chart, you'll see that in 2007, for example, there were only 2 heroin overdose deaths in Oklahoma. Again, look at 2016 where the number was 49, and look at 2017 where that number grew to 59. And what I have to say about that, and for the opioid overdose deaths, those numbers could be higher if it weren't for the use of Narcan that reverses the overdose. We know that last year there were 140 uses of Narcan and 113 reported overdose reversals based on the use of Narcan. Some of the programs at OBN that we have in place to address the opioid epidemic, we operate the state's prescription drug monitoring program, the PMP. Here are some numbers for you. We have over 23,000 medical professionals that have active OBN PMP accounts. We have over 13,000 medical professionals that last year prescribed at least one controlled dangerous substance. We had 9 million prescriptions were written for CDS in 2017, and 48% of those were for opioid medications. A new program that we're starting at OBN is overdose mapping. Overdose mapping, as we roll that out to some of the smaller agencies, that will give us real-time information on when overdoses are occurring in the state of Oklahoma, whether the person survives or does not survive. That gives us an opportunity in real time to try to initiate an investigation to try to stop that from occurring in that area. And lastly, I want to talk about, on the next slide, on that slide, we want to talk about OBN participates in the National Take Back Day, where that we open up locations and we take back unwanted or unneeded prescription medications. That's a very successful program. But what OBN also does, that I want to point out, is that we have 177 take-back boxes in all 77 counties in Oklahoma. And last year, we took back over 26,000 pounds of unwanted medication, and then we ensure that it's disposed of. That's taken unwanted medications, potentially dangerous and deadly medications, out of the hands of people that could be harmed by that. We know that 54% of people addicted to opioid pain medications admit that they first got their opioid pills from the medicine cabinet of a family member or a friend. We'd like for you to see the website that we have listed. If you want to know where there is a take-back box that OBN operates that's close to you, you can go to our website. You can simply type in your zip code, and it will populate all of our take-back boxes so that you'll have access to those. And we maintain those, and you can do it 365 days a year. Or if you don't have access to a computer, then obviously our 1-800 number, 1-800-522-8031, would be a number that you could call. Okay. Thank you.
Thank you, John. We'll next hear from Clyde Shelley, the Special Agent in charge of the Drug Enforcement Administration.
Good afternoon. As you've heard the stats earlier, things are spiraling out of control. Pharmaceutical diversion is one of the biggest parts of the opioid crisis. And in order to assist with this, DEA is bringing a new tactical diversion squad to Oklahoma. This squad will focus on pharmaceutical diversion. They will focus on the doctors overprescribing and prescribing for profit and flooding our neighborhoods. They will also focus on pharmacies not properly maintaining their inventory and diverting this pharmaceuticals into our neighborhoods. Well, the beautiful thing about this is this task force will not only be made up of DEA investigators, but it will be made up of state and local officers, the officers that live with this every day, who function with this every day, patrol it, and fight it every day. DEA will join with the local community in order to stop these epidemics from happening. The Tactical Diversion Squad will be specifically here to Oklahoma and tuned to fight this opioid epidemic. Excuse me. Anyway, thank you. And when it comes to this fight, DEA is all in.
Thank you, Clyde, for DEA's involvement and also for the additional resources brought here to Oklahoma. Next, we'll hear from Dennis Passerman, the Assistant Special Agent in charge of the Federal Bureau of Investigation.
Thank you, sir. Good afternoon. As a member of the Opioid Task Force, the Oklahoma City FBI supports the opioid investigations through the use of healthcare fraud squad that we have here in Oklahoma City. The members of the squad include special agents, intelligence analysts, and forensic accountants. The members of the squad have a particular skill set and expertise to fight the opioid epidemic through targeting the fraudulent activity associated with these crimes. FBI agents, along with their partner agencies, spend months reviewing and analyzing hundreds of Medicare Part D billing records, as well as thousands of prescriptions. The Oklahoma City FBI works on a daily basis to address the opioid threat by targeting medical professionals that choose to abuse their positions. In addition to the FBI Healthcare Fraud Squad, the FBI has 169 safe streets and gang task forces throughout the country. The FBI goal is to identify and target individuals and criminal enterprises who are trafficking narcotics and opioids through a two-pronged law enforcement approach utilizing healthcare fraud investigations as well as drug trafficking investigations. Crimes stemming from the opioid epidemic have the ability to inflict emotional and physical and detrimental effects to all those involved. Thank you.
Thank you. Next, we'll hear from Jason Meadows, the Assistant Special Agent in charge of the U.S. Department of Health and Human Services, Office of Inspector General.
Good afternoon. The opioid epidemic and holding bad actors accountable is a top priority for HHS OIG. Our mission is to protect the Medicare program from fraud, waste, and abuse by conducting criminal, civil, and administrative investigations. We'll do that through this task force. We'll work with our federal, state, and local law enforcement partners to combine our resources and our efforts to investigate, indict, and convict individuals involved in using taxpayer-funded programs such as Medicare to commit fraud, to use opioids to commit their fraud schemes. We'll do this in a couple of ways. We have investigators on the ground that will conduct investigations along with our partners. And we also use data analytics to point us in the right direction. We can review billing data. We can look at outliers in the opioid prescribing community. And combined with that analysis, our investigators will corroborate those numbers and those allegations. Another tool that we bring to the table is the ability to exclude individuals from billing federal health care programs. Since 2017, we've excluded over 580 individuals from federal health care programs related to opioids alone. We estimate that those 580 exclusions will save taxpayers over $200 million over the next 5 years. Thank you.
Thank you, Jason. Next, we'll hear from Rick Adams. Rick is the incoming director. As of July 1st, he'll be the director of the Oklahoma State Bureau of Investigation.
Thank you, sir. Good afternoon, everyone. It's an honor for the Bureau to be part of this initiative in order to combat opioids here in the state of Oklahoma and actually across the nation. One topic that I'm going to cover here is the threat to law enforcement, the threat to emergency workers, and all those healthcare workers that have to deal with this fentanyl threat that comes along with the opioid crisis. Fentanyl, obviously, is a synthetic narcotic, but it's 50 to 100 times more potent than the actual opioid itself. And if you think about what that potency means, it brings about a lot of lethality. Lethality for accidental overdoses, accidental exposures to those healthcare workers, to those officers, and to those lab employees that work and process these drugs in the background. If you think of how much that is, if you're looking at just a few grains of salt that you could fit on the tip of your finger, would be enough to cause lethality in most human beings. And if you look at some of the cases that our agency has processed just in the last year, so far this fiscal year, 22 cases that we've processed are actual fentanyl-related cases, and over 30 cases of actual fentanyl that we've found during processing in our labs. Now, amongst that are 2 big cases. And if you look at the 2 big cases and you just look at the totality of those alone that was taken by one of our state law enforcement organizations with the patrol, over 30 pounds of fentanyl was taken off the road. That is enough fentanyl to kill every man, woman, and child in the city of Oklahoma City. So that's why when these drugs touch our communities, they're so dangerous. It's not just the drugs that are coming legally, that are being used improperly, but it's also the narcotics that are flowing illegally through many of these traffickers that we're all combating in our communities. With that, we are all in to this initiative to try to save the lives of the men and women that we're trying to protect out there that are serving the public and also our communities, and all the moms and dads and pops and children that are out there trying to raise families and hopefully do it without having someone that has to deal with these crises. Thank you.
Thank you. Also with us today, Kevin Caramucci. He's Assistant Special Agent in charge of the Internal Revenue Service Criminal Investigation Division. We appreciate their involvement with our team to help us conduct financial analysis of these investigations, and their partnership is appreciated. Other members of the investigative side that are not able to be with us today is the Defense Criminal Investigative Service. The Defense Criminal Investigative Service has primary responsibility to review federal health benefits claims for veterans and military members under the TRICARE system, and they're a valued member. So the collection of these state and federal investigators working together is one key component. But the other key component is a close collaboration between federal and state prosecutors. Some of these cases are going to go federally, some of these cases are going to go state. Now I'd like to call upon our partner, Mike Hunter, Attorney General of the state of Oklahoma. Mike.
Thank you, Bob. Bob, I appreciate your service here in the Western District. I also want to thank all of our local, federal, and state partners who've joined us today as we pledge our commitment to this team with the goal of making Oklahoma a safer place for our friends, family, and loved ones. Before I go any further, I want to recognize a couple of really great lawyers on staff at the Attorney General's office who are here with me, and they've been instrumental in our efforts combating the opioid epidemic. Many of you already know them. I have the privilege of working with them, and it is a sincere privilege. Joy Thorpe, who heads up our Criminal Justice Division, and Marie Shubley, who's here. Hi. Thank you both for being here, and thank you for what you do to protect the citizens of the state. Our team in the AG's office does a fantastic job, not only in this space, but generally speaking, to keep Oklahomans safe. But I want to mention that just yesterday we were able to announce that the Midwest City doctor who we charged with 5 counts of second-degree murder last summer has been bound over for trial. This is a major development, and I want to thank Joy and Marie for their great work on this case. And I also want to mention that this successful outcome would not have happened without the help John of OBN and the Oklahoma County District Attorney's Office. They've shared resources throughout this investigation and have enabled us to put together a solid case against the doctor, as well as in other cases that we are currently prosecuting. In this particular case, this doctor is among a minority within a minority of prescribers in the state. I want to emphasize that most physicians are doing exactly what they need to do for their patients. But this doctor was prescribing thousands of pills per month to patients without any legitimate medical need and in circumstances that we determined were in extreme disregard for their lives. As our case indicates, we believe that her overprescribing habits resulted in the death of at least 5 of her patients, and this is what we intend to prove in front of a jury. When doctors engage in this type of practice, they are effectively acting as drug dealers, and we have a zero tolerance policy in our office for this type of behavior. We are committed to holding them accountable, just as we are committed to partnering with the other agencies represented today through the Western Oklahoma Opioid Enforcement Team. Strengthening this already solid alliance with partner law enforcement agencies will give us the upper hand to combat this epidemic as it grows more dire each day. We continue to lose an average of nearly 1,000 Oklahomans per year to overdose deaths. The epidemic is a complex problem with more than one solution. That's why it makes complete sense for those of us here today before you to form an alliance and commit to working together to tackle all aspects of the opioid epidemic. All of these agencies play a unique role in combating the epidemic, and just as we are here today to reaffirm our commitment to one another and the state of Oklahoma, I want to say that our office, the Office of the Oklahoma Attorney General, stands by ready to assist anytime that we are needed. And I'm proud to say the office has already worked diligently to combat the crisis, whether it's through the Oklahoma Commission on Opioid Abuse, which helped create laws to criminalize fentanyl on the state level, provide proper oversight to medical clinics, and mandating e-prescribing for all drugs, among other things. Through getting drug dealers off the street, as we did in the case of Dr. Nichols, or last month in a case in Carter County, where an alleged drug dealer sold a young woman a lethal dose of heroin, or through our lawsuit against the nation's leading opioid manufacturers who are responsible for this epidemic. We're making headway, but we can't do it all on our own. To further our mission, it requires partners who are ready, willing, and able to work together to share resources and collaborate for the benefit of our state. I have no doubt that together we can stop this epidemic and make our cities and communities safer places for our neighbors and loved ones. Thank you all for being here today. I look forward to working together with each of you to get a handle on things.
Thank you for coming today. Thank you to members of this team and our effort to work together to combat this opioid crisis.